Rob Andrews, he runs something called the Health Transformation Alliance, which is a fairly new kind of organization, which it's currently 40 companies, right? That's right. I think IBM was one of the main progenitors of it. It's a group of 40 large companies that provide health care to their employees, a total of 6.5 million employees. They spend a total of $25 billion a year. And I want him to tell us what he's doing with that. But before I do, I just want to also mention he was a 24-year congressman.
I'm a recovering.
He was a congressman, a very senior Democrat in Congress from New Jersey, who, I love this in your bio, you hold the record for the highest number of votes ever received by a House candidate in New Jersey. That's a pretty cool thing.
Many of them were actually alive, which is...
But so, because we have actually a little more time, the clock doesn't show it, but we have a little more time than we would have originally. And so, in addition to talking about the Health Transformation Alliance, I want to ask him a little bit about some of these issues of policy that have come up repeatedly throughout the day. So tell us what you're doing and why it matters, first of all.
You know, I come to these conferences over the years, and I've left with a mixed sense of invigoration but frustration. And the invigoration comes from the speakers I've heard this morning. The frustration comes from the fact you feel like you leave and there's not a follow-up mechanism to really push the good things you've heard. The HTA is really intended to be one of those follow-up mechanisms. We want to spend as much of that $25 billion a year on things that work, on things that would help someone not become a type 2 diabetic, on ideas that would help that person become more compliant with their meds that the last gentleman just talked about. We are 40 self-insured health plans, 2 of which are Johnson & Johnson and Kaiser Permanente, we're very happy to say. And our objective is to align as much of that spending as we can with care pathways and care procedures that pass the rigorous test of analytics. They work. Now, I understand in healthcare, it's part art and part science. And defining what works is not as easy as it would be with a cell phone or an automobile. But there are certain objective criteria that we think can be evolved. We're working with IBM Watson Health to help do that. And we want to steer as much of that spend toward what's effective. Effectiveness to us means a stroke that doesn't happen, a heart attack that doesn't happen, a life better lived. That's who we are.
So is it about, okay, you started with how many companies?
We started with 0.
Started with 0.
We grew to our original 4, which was American Express, Caterpillar, Macy's, and Verizon. That 4 jumped to 20. We added Coca-Cola, IBM, DuPont, Marriott, International Paper, Next Era Energy, et cetera. And then
now you're 40.
The 20 has grown to 40.
Right. So is the goal just to make things better for those 40, or given that you have this policy background, do you hope that it'll have even more of a macro impact once you start throwing the weight of $25 billion of spending around?
The goal is most assuredly to have a systemic impact. If we work together and devise a system that takes people away from the path of type 2 diabetes and prevents the diabetes from ever materializing, that's not a proprietary secret. That's not a piece of intellectual property. It's a best practice that people on Medicaid or Medicare or other systems can have. You know, systemic change, President Kennedy famously said that a rising tide lifts all boats. We want to be part of that tide. And we understand that this is not just a moral interest, although it most certainly is. It is also pecuniary. Self-insured health plans are paying bills for people indirectly who don't work for them. If you pay a hospital bill and the hospital has 11% of its patients come through the ER door uninsured, the other 89% of the patients pay for that one way or the other. So obviously, our members would benefit from the moral progress that would be made by greater health care, but there's a very direct economic incentive as well, so you bet we want to be systemic.
You know, and I should have said something at the outset, just some interesting statistics. You know, the U.S., one of the interesting things in Dan Monroe's article in the Techonomy magazine is he points out that there is no other developed country that has this system of employer-provided health care. We all think, oh, that's the way health care is provided because that's how many of us have lived our lives. In fact, no other country does that. But in the United States, 155 million Americans get their health care through their employer. Yep. and this is some statistics I took off of Rob's website, cost to those companies has risen 50% in the last 10 years. And just in 2016, private spending on healthcare was up 6.1% to $67.6 billion. So, it's a big amount of money that's spent in a really weird way. And, quickly tell us, why did the U.S. end up with this crazy system where employers provide the healthcare in the first place?
It's a historical accident of the Second World War. And a lot of you know this, that when we had wage and price controls during the Second World War to avoid inflation, a lot of companies were competing to hire more people and could not raise their wages. So they began to pay their medical bills. And so out of that accident of wage and price controls has evolved the present system. And you mentioned—
Just give something somebody wants that you never take it away.
You really don't unless it's Washington. But the
Right
most
now.
recent Affordable Care Act discussion. But,
They haven't done it yet.
But if you mentioned the facts about the cost to employers, the cost to employees has been worse.
Okay.
That in an inflationary environment where since 1999, the price of everything, food, transportation, housing, has gone up by an aggregate 44%. The cost of out-of-pocket costs for health care for employees has gone up 204%.
During what period is that?
Since 1999, in this
Wow.
millennium. So it is the woman who's, changing the bed linens at Marriott, or the guy driving the truck for Coca-Cola, or the person in the call center for American Express. They've taken an immense pay cut, in part because of health care. So we're about trying to achieve better value and sharing that value with the men and women who work for us, not simply keeping it for ourselves.
Well, another interesting thing that I mentioned, I don't know if you were at the very beginning, I noted Warren Buffett's statement last week, which is very much kind of supporting your whole approach, where he's basically saying employers are paying a higher price in their competitiveness because of their health care costs than their taxes, which was really a shocking thing for many people to hear. But do you agree with that?
It's absolutely true that American entrepreneurs are at a competitive disadvantage when they look at their global competition because of the way we pay for healthcare. Now, there's an interesting political debate that flows off of that about single payer and other ideas. But of course, we're not a political organization. We try to be a problem-solving organization. So what we're trying to do is find a way to address what the Institute of Medicine identified as 30% of the money spent in the U.S. healthcare system as being wasted. What is that waste? Some of it is fraud, waste, and abuse. It is the Medicare mill physician, or it's the cost of defensive medicine driving up practices. Most of it, though, are procedures that aren't really medically called for. It's the spinal fusion that really should be physical therapy and weight loss. It is the $10,000 psoriasis drug. Everyone now seems to have psoriasis if you watch television. It's the $10,000 psoriasis drug that could be cured by a heat lamp. And I say this delicately and carefully, but it's the elective C-section that perhaps isn't what's best for the mom or the baby. Not that we don't want to interfere with that choice, but educating people about the consequences of that is something we ought to do.
Well, it reminds me of something Esther didn't get a chance to say on her session earlier, that one of the community leaders in one of the towns that she works in told her, she said, "What is the biggest health problem here?" And if I could quote you, he said, "It's obesity, and therefore we need a special clinic for bariatric surgery."
Yeah.
Right?
Yeah.
That is not the mindset that we want, right?
Well, the Cleveland Clinic and NYU, and there are probably some people here who are authors of this study, released a study about 3 weeks ago that pointed out that obesity is really the number one cause of, not of death, but of loss of healthy years of living. And it does tie into type 2 diabetes, it ties into hip and knee replacement, ties into lots of other things. And so, look, we are not an organization that will answer these questions. What we will do is invest in people who can answer those questions. What we're really trying to do is create a demand, a forcing function. My daughter, my youngest daughter, is interning at the Cannes Film Festival this summer, which is really cool. She's a student at USC in the film school. Any of you are from movie studio, I have her resume with me, which I like. And I was able, on my smartphone, to talk to her this morning face-to-face and see where she was living. That's astonishing. That could have, on 9/11, I had a BlackBerry, and I was able to email back and forth with my wife to let her know I was okay. Look at where we've come in those 16 years that have happened. Why did that happen? It did not happen because the federal government set up, I'm not good at this.
It fell off.
Taping systems and politicians don't go well together. The
Very topical joke. Okay.
as it were, the federal government did not create a Department of Personal Communication. We didn't start a bariatric surgery lab for communication. People demanded it. They said, I want to be able to talk to someone on the other side of the world on my phone, and it happened. Now, healthcare is a lot more complicated than that. But we want to take that $25 billion and growing that our members spend and demand that people figure out a better way to educate people about their weight and their exercise to avoid type 2 diabetes. And as the last speaker just said, we won't ever solve this problem directly, but a 10% incremental gain will save tens of thousands of people's lives.
Okay, so quickly, just how do you think about technology fitting into the work that you and your members are focusing on?
I think that technology rightfully applied will be the differentiator. It'll make all the difference in the world. See, I believe if the Chicago Cubs can figure out a way to win the World Series by using analytics, something people never thought would happen in their lifetime, and literally this is true, right? Theo Epstein and that group figured out analytics to build a better baseball team. Well, why in God's name can't we do that to figure out a way to get people to quit smoking or to lose weight? It's not easy, but to say that we can't do this is ridiculous.
Okay, so let's just, I do want to hear audience questions. We've got another 5 minutes, but you were in Congress for a long time. You understand how it works down there. I made a strident statement before. Were you in the room when I made my statement?
Yes, I was.
I mean, about
I stayed in the room.
It's a broad generalization, but and it goes well beyond healthcare. But my generalization is that we do not have a technologically savvy or cognizant government, and as a result, that is becoming a competitive disadvantage for our country. Is that an extreme statement in your opinion?
No, I think it's an accurate statement, although it's not a universally accurate statement. There are members of Congress, Zoe Lofgren from California comes to mind, if any of you know her, that are very technologically adept and can follow these issues. The problem is that it's not the answer to the questions we're coming up with, it's we're asking the wrong questions in American politics. And this is a long rap, but we've really devolved into an orgy of blame. Whose fault is it that so many middle-class Americans are working harder and going backwards? Whose fault is it that a quarter or a third of Americans are locked in seemingly permanent poverty? Whose fault is that? That's an interesting question. It's ultimately an unproductive question. And so there are two sets of answers to that. It's the fault of the top 1% and the corporate elite and corporate America, or it's the fault of government and the media and minorities and immigrants, and pick your poison. They're both poisonous answers. So I mean, I would say that if we begin to look at technology not as a neutral force, but as a conscious choice to solve the properly defined problem, this is how we can make great progress. It is, Michelle Obama, let's take this as an example, tried to alter the school lunch program in a very thoughtful and very intelligent way. Now, we can quarrel with the way that was packaged or messaged, but her scientific principles were just right. That was done away with, at least in theory, about 2 weeks ago. I think she was asking the right question, and I think if we continue to ask the right questions, we will eventually achieve the right results.
Well, that's cool. Okay, we got a couple minutes for quick comments or questions from the audience. You've asked several, but they've been good, so we'll get the mic for you again. No, you're okay. Just keep asking good questions. And that's okay.
Thank you. Kange Kanene, SAP. Question for you. You're talking about causing demand in education, but when you think about self-serving medical conditions like being obese, it seems to me that it's not the case of education. Like I think most people know if you eat McDonald's every day, you get bigger, right? So I'm just trying to understand more what your service is. How do we translate that to actual results?
We believe passionately in data and evidence. So what we intend to do is create an ecosystem, 6.5 million lives, where people with great ideas can try them. And we will collect data on what works and what doesn't. I mean, let me use this example, which goes to your point. I don't mean to be disrespectful to anybody in this healthcare consumer engagement field. They're all trying their best. The results are pretty terrible. Now, who here knows what the annual fundraiser is for Crohn's disease? Who here knows what the annual fundraiser was for ALS? The Ice Bucket Challenge. Who's heard of the Ice Bucket Challenge? Okay. So thousands of people, millions of people poured ice water over their heads 2 or 3 summers ago. Something happened to make that happen. We want to talk to the people who did that. And that's someone who understands consumer behavior and consumer psychology. And until we do understand that sort of thing, we're not going to make significant gains with the obesity, bad pun, make significant losses with the obesity problem, I guess is the best way to put it. So we understand what we don't understand, which our members are terrific at filling hotel rooms and getting credit cards sold and getting cell phones out. We want to take the same analytical genius they have on that and apply it to obesity and asthma and smoking and lack of compliance with people's meds. Are we going to solve this all by ourselves? Absolutely not. But we're going to insist that we find people and hire them who can.
Hey, Simone, do we have time for another? But maybe one more question?
And I'll give a
Who has a
short
very
answer,
short?
too.
Short. Okay, here. Let's get the mic over here. Thank you very much.
To make the comment
Lynn
goes
Voss?
to Lynn Voss, Gray Health Group. The irony and the interesting thing about noncompliance and even drugs, we know that pharmaceuticals work, right? And we know that noncompliance is 40%. Every dollar that's spent on every drug that's not taken more than once is really the biggest waste.
Yeah,
So
it is.
I think it would be really interesting to take that back to your corporate group and
Yeah.
put a stake in the ground that all of that is wastage. So that's where the cost is.
We
it's
agree.
really and
The worst example of that is on cholesterol. The Center for Disease Control published a study in late 2015 that said 58% of Americans who are at risk for cholesterol-related disease are doing nothing about it. They're not under some kind of doctor's care, or they're not taking their meds that they could be doing something about it. Imagine what would happen if we changed that 42% compliance to 52 or 55. So yeah, we're very interested in that.
this is kind of the opposite. It's kind of another way of thinking about it.
Yep.
We should never even start therapy if they're not going to take more than one pill because all of that money is wasted. So we have never looked at it from the other side, which is the majority of diabetic patients only fill their prescription once.
Yeah.
And so again, it's just an incredible waste that goes into the first prescription.
We agree, and we're looking. Our theory is there's 2 women out in Palo Alto that are roommates that have an answer to that. We want to find them and hire them.
Good.
That's what we're about
All
doing.
right.
So
Thank you so much, Rob.
thank you very much.
Really good.